iliac crest here, I'm going to come down, and my thumbs are, because of the size of my hands, I'm going to fall right onto the PSISs. Okay? So then again, I'm going to come under the PSISs and push up, and looking for symmetry. Right? Now, for the sacrum is a goofy beast. The joints, how it articulates with the ilia is not a typical joint. And so there's a lot of shearing that can happen there. And so it's easy for the sacrum to get out of whack. And it can do all sorts of crazy things. So the axis of the sacrum for movement is actually, there are 2 oblique axes. And so you need to be able to palpate in 4 different locations on the sacrum. Okay, so that's the picture on the left. So the sacral base is going to be right where you come in off the PSISs. So I'm at the PSISs, I'm going to come in, and I'm again looking to see if one side is more posterior than the other. Then the other place is what's called the sacral angle, and that's where, see how the sacrum goes down and then bends in? Mm-hmm. The sacral angle is right at that corner. Okay? So I've got iliac crest, I come down onto the PSISs, I come in, I'm now on the sacral base, of which Sarah is not symmetrical. Okay? Then I'm going to palpate down along the edge of the sacrum until it starts to curve in. And then I'm going to go back, and that is going to be the sacral angle. And now again, she's not symmetrical. Okay? So I'm looking for one to be more posterior than the other. All right? So you're going to palpate the sacrum at the sacral base, which is proximal, and then the sacral angle, which is distal. Coccyx is going to be down even further. So once you've come in off of the sacral angle, then I usually use one finger to palpate down. Okay? Now, there you're looking for symmetry. You're also looking if it has gotten tucked anterior. Both of those things can cause excruciating pain. I told you that there are some physical therapists who will do intraanal mobilizations of the coccyx. I will not be teaching you that in this class. Okay? For PTs who are willing to do that, it gives patients, again, just considerable relief. So that would fall in the women's health category. So right now I just want you to know for symmetry, because if it's not something you're comfortable with, then you would know to refer to a physical therapist who was able to do those kinds of mobilizations. So you're palpating for symmetry for left, right, and then also how much it's tucked down, and for reproduction of symptoms. Okay? Now, some of the other structures that you're going to palpate posteriorly are the ischial tuberosities. Now, those are the sit bones, the avoidism. Okay, so we're palpating these. Again, we're looking for symmetry. So typically what I will do for that is go down to the gluteal folds and then push up. Okay, and they should be right there. Now again, we're palpating for symmetry of those ischial tuberosities, because if one ilia is rotated compared to the other, those ischial tuberosities will not align. Right? Oh, thank you. Greater sciatic notch, I'm actually going to do in sideline. So I'll skip over to the ligaments. Sacrotuberous ligament, where does that go? Sacrum to the ischial tuberosity, so it's one of those nice names. So it's going to come off the sacral angle and to the ischial tuberosity. It's going to be, did you dissect out this ligament? Did you get through the gluteal muscles?
I don't think so. I don't think anyone did.
We shredded it.
Shredded the gluteals?
Yeah. On accident.
Oops. So the sacrotuberous ligament is actually quite thick. Okay? So so it's going to be traveling in this direction. So what direction am I going to be palpating? cross, right? So I'm going to be going this way. So I'm going to come in here. I feel like I'm already on, I was too low. Right? You all may be able to see I'm off, on, off. You see my hand is deep, up, deep. Okay, so I'm rolling over it right there. Okay. Yeah. Oh, wait, I'm getting ahead of myself. All right, so that's sacrotuberous ligament. The iliolumbar ligament is going to go from the iliac crest to the lumbar spine. That's going to be the most distal part of the thoracolumbar fascia. Okay, so it's really, it is a ligament because it's thicker than just the fascia, but it's really pretty contiguous with that. So that's going to run this way. Okay, so you're going to want to palpate across. And it's going to be fairly deep. So my fingers are fairly perpendicular. And I'm going cross because I need to get through those muscles to feel that ligament. Right? Is there anything, can you go one more for me just to see if there's anything else before I have her go into sideline? No, okay, good. Alright, so the last structure you need to palpate is the sciatic notch. Okay? So it's this little cutout of the ilia. The sciatic nerve travels through there. The piriformis attaches to the side of the sacrum and comes across and attaches to the femur. That can apply compression to the sciatic nerve as it leaves the sciatic notch. So it's going to be very important for people who have symptoms going into the back of their leg to see if the compression of that nerve is happening at the sciatic notch. Okay? You can palpate that. So the sciatic notch, you basically are going to go PSIS to ischial tuberosity, and it'll be halfway in between. Okay? It's a little bit easier to palpate in sideline. So I'm going to take this from you. I'm going to have you face me. And I'm going to put this on your head. And I'm going to have you bend this leg and just drop it forward. And you can go ahead and bend this leg, whatever's comfortable there. Are you? Yep. Are you good? Okay. So PSIS, ischial tuberosity, I'm going right in between there, and I'm palpating that sciatic notch. If I go this way, I'm hitting her ilium. Okay, so I know that right there I'm in her notch. Okay, so again, looking for reproduction of symptoms, shooting pain on her posterior thigh. When we get to the hip, we'll talk a little bit more about piriformis and where you might palpate piriformis to see if that's implicated as well. Okay? All right. So, your structures, iliac crest, PSIS, sacral base, sacral angles, ischial tuberosity, sacrotuberous ligament, iliolumbar ligament, sciatic notch. All right? Ashley's excited.